The Dr. Fazil Show is brought to you by Health Tips Media. The Dr. Fazil Show is intended for health education purposes only and complies with all HIPAA regulations. All of the CDC guidelines for COVID-19 safety were followed while filming this episode of the Dr. Fazil Show.
Thank you, audience, for watching January 2022 edition of Dr. Fazil Show. As you all know, my name is Dr. Fazil. I'm both an internal medical specialist as well as kidney specialist. So I have a knowledge of both the specialty as well as family medicine. So today the topic of discussion is, as we know, we are immersed in various new infections, which was not obvious or pandemic in the past. We are being immersed in new infections. So let's take a deep dive and see what's happening new and what can we do today so we can stay out of trouble and can avoid all those infections. So today we're going to talk about two more things, and I know people have chronic COVID fatigue from being listening, isolation, being told what need to be done to prevent COVID-19. And again, I say, I don't know if we're going to call it COVID-19 or COVID-2022 because it started in 2019, but since then it has changed dramatically with various mutations, including causing a new variant, as we all know, a Delta version. Then Omicron came in, and then we have a new version just came out is known as Deltacron, which is actually a combination of Delta virus and Omicron. So the big media has not given too much coverage to that new version yet. But my fear is that if we don't understand what is the next version coming in, we would not be ready to avoid that. So there's a few misconceptions I need to clear up today. Number one, the Omicron, as even told by WHO, we keep calling it is more contagious, and we know that it's a lot more contagious than Delta versions. And we also keep saying it's mild. It is actually not mild, it is less severe. So less severe means it's not as severe as Delta is, but it's severe enough to put you in the hospital and even have a bad outcome causing mortality and death. So we should not be misdirected or misinformed or lowering our guard by saying, okay, yeah, well, Omicron is more contagious, but it's mild. We should say it is more contagious and less deadly than Delta, but it is still deadly. So you can see that our healthcare system has been swamped recently by the new version, and this Omicron is actually a dominant strain worldwide at the moment. We haven't achieved the herd immunity, and the reason we haven't achieved the herd immunity, and let me explain the herd immunity before that. So herd immunity means on this side you can see that when majority of patients have got infection and people who have not immunized, they get immunized from the other patients which have got vaccination or infection by passive immunity. So they don't have to take immunization, and they get immunity due to mild infection which they carry from the people who have been vaccinated or recovering from COVID infection. The reason we have not seen the herd immunity is, I think, various reasons. Number one, the virus keeps mutating. So it's like we're chasing our own tail. The virus which we get vaccine of, for example, for Delta, by the time we got critical momentum for herd immunity, it changed to Omicron. So now we have to make a new dose, like a booster dose, which would give protection against that. So that's the reason we have not achieved the herd immunity yet. In most infections, we do get herd immunity, like in flu. So The vaccine is once a year after that, because every year the virus changes, and then you need a new vaccine dose for flu infection. One thing in the flu is that it's mostly dominant from October till April in part of the year, because it is generally a winter virus. Unfortunately, this COVID-19 or COVID-22 is not dependent on the weather. It is throughout the year, and you can see that. So actually it gets to some extent less dominant in winter, because as we all protect ourselves from flu by using masks or staying indoor or taking other precautions. So the technically the Omicron version Omicron infection should become less in the winter, as we are used to protecting ourselves against flu by taking protective measures like hand washing and sanitization and staying away from the patient who are sick. So this is the basic concept of herd immunity, and what's the difference between COVID-19 virus versus other cold viruses that include flu and viruses like that.
Now you can catch up with all of our previous shows on all Roku devices. Simply search for the Dr. Fazil Show channel and add it to your home screen. View our videos online by visiting our website at www.drfazilshow.com. Our videos are available on YouTube by searching for The Dr. Fazil Show. And don't forget to subscribe to our channel. The Dr. Fazil Show is available in multiple provider office waiting rooms across Yuma, Arizona. Don't forget to get your copy of Health Tips magazine and read about this interview, currently distributed across Yuma, Arizona.
Let's move on to what are the new arsenal we have at the moment for treatment or prevention of Omicron virus. Obviously, we have talked about vaccination, like first dose, second dose, depending on what vaccine you're getting, but also taking booster vaccine. Chile is the only country which is giving the fourth booster, so that means the fourth booster would be coming soon in a lot of countries. I know it actually causes a lot of frustration on the patients because they want to get over this virus, and they're expecting, okay, one was good, the second is good, and the third we have to take booster. Fourth would be really asking for a lot. But we have to know that we are fighting against a very ruthless enemy. So because of that reason, we should do what we must. And that includes taking booster vaccine, which is actually due after 5 to 6 months after at least 6 months after the last dose you got. This is the guidelines at the moment. So if you have high risk comorbid conditions, you should take the booster vaccine if you're due for that. That's one way to protect yourself. And also, Pfizer and other big pharma is working on getting vaccine specific to the new version. So hopefully we'll get that version in timely fashion, so we'll get vaccination before the virus have chance to mutate. Now, one thing we have to also know that this is a worldwide event. So if we are treating developed country but not treating the underdeveloped country, then this infection is going to stay throughout the map of the world. And that's one of the reasons that we're getting all those mutations, because we give vaccination to the countries which can afford to have it, and the patients which or the countries which cannot afford to have it, that's where the virus is replicating fast, and it always mutates. So it finds out what vaccination is being used, then it becomes like a superbug, and it comes back with the new mutation. So that's the problem at the heart of the whole thing. We have to know why we're getting new versions, why the vaccines are not as effective as we think they should have been by now. That's the reason. So this is a global effort and not just a local effort. So as long as for one way or the other reason we cannot vaccinate the whole world, then we have to use other old technology, masks and hand sanitization and social distancing. I know it kind of went out of the window when we started doing the vaccine. Scientifically speaking, that should be important as well. As I said, that you live once, so if you're dead, you're dead. I mean, there's no coming back. So we should do anything and everything possible to protect us and our loved ones and the people who we care about, and or the whole society, not just about us, by following the new guidelines. That's about the COVID-19 vaccine and COVID-19 epidemic. Let's talk about another new infection which has become prevalent recently, and we are seeing the waves of hepatitis A. Hepatitis A is actually another virus which is transmitted through feces to the food transmission. So somebody's feces have hepatitis A virus, it got way into the food, and then you eat it, and then you get infection of hepatitis A. Now we know about hepatitis B and C, which is transmitted through blood transfusions or injections or like needle stick injuries. But hepatitis A is spread orally. Recently, we have seen a lot of patients coming up like a cluster in different part of the country, which is actually infection of the third world country. We're also seeing in the USA now. What are the symptoms and signs of hepatitis A? It can cause jaundice, like yellowness of the eyes. You can see right here. It can cause abdominal pain, itching, and abnormal liver function test on the blood test. So have to be careful. If you have symptoms like that, we should be checked for hepatitis A. And there are some guidelines now to even get hepatitis A vaccine. Generally speaking, hepatitis A vaccine is used when you're traveling to third world country. But I'm seeing this new epidemic also taking shape in this country. If you cook the food, the virus will go away. But if you're eating the raw food or food which is not cooked thoroughly, and somebody who have hepatitis A, and if they touch that food and they have had fecal material on their hand, it can infect you as well and cause that hepatitis A infection. So make sure you wash your eatables if they can be washed, for example, vegetables and fruits before you eat it. Sterilize your hands and make sure the food is well cooked to prevent this new problem which we're seeing recently in the United States of America or USA. At that note, I'll keep you posted the new updates on Omicron, Deltacron, Delta virus, and hepatitis A. So stay tuned. I will be back next month with more information about this topic or another topic which is important for your health and our health. So thank you for watching this show, and God bless. Dr. Fazil.